In today's video, we're going to be covering folic acid mechanisms of action, folic deficiency anemia, pregnancy teaching, dietary sources, nursing assessment, lab monitoring, medication interactions, and patient education. Okay? Folic acid is a supplement form of folate, also known as vitamin B9. The most important job of folate is supporting DNA synthesis. This may sound a little bit abstract, but for nursing students, the practical meaning is this. Folate helps cells divide and mature correctly. This matters especially in the bone marrow because red blood cells are constantly being produced there. When folate is low, DNA synthesis becomes impaired. The bone marrow cannot mature red blood cells normally, so the patient can develop megaloblastic anemia. Those red blood cells precursors become large and immature instead of developing into healthy oxygen-carrying red blood cells. So the simple memory trick is thinking folate supports DNA and red blood cells. Okay? Folic acid is used to treat folate deficiency anemia, prevent deficiency in high-risk patients, and support pregnancy. In pregnancy, folate is critical because it helps prevent neural tube defects. The neural tube closes very early in the pregnancy, around the first month. So often before a person even knows they are pregnant, it's recommended to start taking folic acid or vitamin B9. Alright? Now, commonly dietary sources of folate or vitamin B9 include leafy greens vegetables, beans, legumes, citrus fruits, asparagus, broccoli, and fortified grains. But if the patient is deficient or pregnant, diet alone may not be enough, so supplements may be prescribed. So, final recap, folic acid is vitamin B9. Its main jobs are DNA synthesis and red blood cell formation. Folate deficiency causes megaloblastic anemia. The patient may have fatigue, pallor, weakness, shortness of breath with activity, and glossitis. Last maybe show anemia with an elevated MCV. Folic acid is used for folate deficiency, prevention of deficiencies, and pregnancy support to reduce the risk for neural tube defects. The high yield safety point is the vitamin B12 comparison. Folate deficiency and B12 deficiency can both cause megaloblastic anemia, but B12 deficiency can also cause neurological damage. So if the patient has numbness, tingling, gait changes, balance problems, or memory changes, you have to think on B12. So do not use folic acid alone to treat possible B12 deficiency unless B12 deficiency has been ruled out or is being treated already. And folic acid may be good to correct the anemia while the neurological injuries continues. Okay? Now, for nursing care, you need to monitor CBC, hemoglobin hematocrit, MCV, reticulocyte, folate level if order, and symptom improvement. Okay? Teach folate-rich foods like leafy greens, beans, citrus, or fortified grains. Review the medication, okay, like methotrexate, phenytoin, and trimethoprim. You know what I mean, because they can affect folate pathways. All right. Final memory phrase: folate equals blood. B12 equals blood plus nerve damage. Okay. Have a good one. Don't forget to subscribe and let me know what kind of videos you want to see next. Thank you.